All right, so let's start the talk for today. And I think I think it's an interesting time in everyone's life. The last 2 years have been. I think we have seen it all. I don't know what else is to be. I mean, remaining to be seen. So, then I do feel that homeopathy has a very strong place in today's times. Homeopathy, healing, peace has a very strong role in today's times. So, what we can do, I think we can just upgrade our skill set. Yeah, that's the best what we can do so that we will be ready for any eventuality of patients of different suffering. So, we are going to start from today's case. Very interesting case I'm going to share with you today. So, today is a case of a 15-year-old male patient whose main diagnosis is epilepsy. It's a very beautiful case, actually. Something that something we learn a lot from. Okay, let's see. So, what are the history of the complaints? Let's see the origin, duration, progress of how the problem started. Okay. My voice is not audible. Voice should be okay actually. I've tried to check all connections and I'm trying to do it from my clinic today so that the audio and the video is very clear for you. Okay. All right, let's come back to the case. Let's come back to the case. So, this is a case of a 15-year-old boy with epilepsy. So, how does the father describe the complaints? Okay, so the history initially is given by the father. Father is a layman, but he has a lot of faith in homeopathy. A lot of faith. He comes and he brings the child in front of me. He stays in some part of southern India, and he brings him to right from. Um, he comes by train with his child, brings him to Mumbai, and tells me about that. My child has convulsions, and I know only homeopathy can help, and that's why I brought to see you. This is interesting, no? When someone brings a patient in front of me and tells me, I know only homeopathy can help. It feels so good when you see such kind of faith in laymen. You won't believe in today's times, and I'm telling this more in India more than other countries. Many laymen have more faith in homeopathy than homeopaths themselves. Today morning, I did one case from, I think, from Jharkhand or somewhere. And the patient had so much of faith. He said that, I'm not taking any allopathy, anything. I have 104 fever. I know only homeopathy will cure me. It's just so, fascinating to see such kind of faith. So I always tell my colleagues and my students and everyone that, you should, in your initial days in your practice, you should meet some laymen who have faith in homeopathy so that your faith in homeopathy as a young kind of rookie homeopath increases. So I was lucky enough to meet some fantastic patients and their relatives to kind of to motivate me to believe more in homeopathy. Sometimes patients will give you more faith than your teachers or your books. So this guy brought him and he said that, since 2017, he's getting epilepsy. The MRI although shows nothing abnormal, but he gets kind of status epilepticus, which means the convulsion remain for 20 minutes like that, like that, and we can't do anything, he says. And they repeated the scan, and during one of the episodes, he became unconscious during convulsions. And on the MRI, it showed a huge edema, cerebral edema. And because of that, he's on anti-epileptic treatment, and his life has been really, really, really um, bothered in that way. So I asked him to describe about the current symptoms. He says that in the last few years, the convulsion has increased and there is a status epilepticus. So I tell, okay, uncle, no problem. Abhi, I tell him in Hindi and I will convert that in English for you. I said, okay, just exactly tell me what are the symptoms from head to foot before, during and after the convulsion. आप ये फिट के पहले, फिट के दौरान, फिट के बाद सर से लेके पांव तक क्या क्या तकलीफें हैं वो डिटेल में बताएं. So I told you in Hindi and in English both so that you get an idea. So this is, I got the entire history, my assistant will take the entire history and bring in front of me. But there is, there is still sharpness and clarity required, and that's where I come into the picture. So I asked him, tell me in detail. So the patient father tell that, when he forget the anti-epileptic medicine, he get the fit. But typically, doctor, मैंने देखा है, I have seen that these fits are typically during the sleep. I have seen this. I said, Acha? I said, okay, I'll note it. That it is more, during the sleep. Acha. Tell more. What else have you seen? Batao. Tell me more. Even while and after eating, we have seen. But we are not sure. But I know this. Huh? I said, Acha. What else? Before the attack, also there is a little dizziness, little vertigo. I said, okay. Tell me what happens during the attack. During the attack, his hand and feet are trembling and they become very rigid and eyes are turned upward and right side like this. I said, what else? He becomes totally unconscious during the attack. Suddenly he becomes unconscious. He's just not in consciousness. He will vomit. He will sweat a lot. But doctor, I have seen one thing. He sweats a lot after the convulsions. We have seen this. After the convulsion, is so much he's sweating, doctor. It is very, very scary. I said, Acha, okay, tell more. No memories of any events, doctor. He develops headaches a lot and he has to take painkillers, doctor. And huge swelling all over the body. He has put on a lot of weight. He has taken so many medicines, no, doctor. I said, okay. So, in my case, I give a lot of importance to sure shot solid symptoms. So this is what I like to call this area. This is the most important thing in homeopathy. That is eliciting the characteristics. This is very important. You have to go in depth. Chief complaint, go in depth. Achha, tell me what happens here. Tell me what happens. Tell me what happens before, during, after. Sometimes I give, tell me what happens, eating, drinking, sleeping, urinating, what happens. I give them options a little later so that they understand. Eliciting character, this is the key. One patient told me, I get piles. I said, okay, what happens in your hemorrhoids? He gets hemorrhoids. He said, I bleed a lot. I said, how much you bleed? He said, I bleed so much. I said, okay, you go back home, click a picture of that of the bleeding and send me. First you do that. I want to exactly see what is the bleeding like. Is it dark? Is it bright? Is it clotting? Is it not clotting? Bright red bleeding in hemorrhoids could give you a remedy like millifolium, could give you a remedy like nux vomica, could give you a remedy like sabina. A dark clotted could give you a remedy like hamamelis. So the idea, and there are many more remedies. I'm not here to tell you about remedies for different clots, but I'm telling you that this is so important, and this is what is missing in lot of case taking is missing. This eliciting the characteristics right till you get that exact solid symptom. Now I got these two symptoms. I got two symptoms. One is he gets unconscious during convulsions, and he sweats a lot during convulsions. After convulsion, after and during both. And the convulsion is more during sleep, possibly eating also. So, already in the case, I just have the 4 most solid symptoms of the case. And to be honest with you, I already know the group of remedies I'm thinking about. Although it's not confirmed, but I know. But I'm still with an open mind. I have to still take the rest of the case. See, I'm now It is almost 1 month into our course. Now I'm going to take you to the next level. I'm going to tell you how I think. I'm going to make you start thinking the way we think. Classical homeopathy is not, it's not like, tell me more, tell me more, tell me more. It's not going to work like this. You have to learn to elicit. When you listen to something, what do you mean by bleeding? What type of bleeding? Is it before the hemorrhoids, during the hemorrhoids, after? Go in depth. Jao. Go in depth. That is the thing. Are you all with me, or have you all fallen asleep already? Okay. Some of you are awake. That's nice. Good to know. Now we'll go ahead. We'll try to go. We will listen very, very carefully, very calmly, with a very clear mind, open mind. We will try to listen to all different areas. We'll try to touch till very nicely the portrait of the disease comes in front of you. Very slowly, very calmly, with a cool head. In Hindi, बहुत प्यार से. It's very beautiful to listen to the history, understand. You have to be very calm while the history is on. Sometimes you also have to get angry. No? You should show all the emotions. You should do whatever is required to elicit that peculiarities. I'll give you one example. One day, the great Dr. Pathak, okay, he saw one case many years back of a man who came with a big eczema, eruptions. So the man told, I have eczema, I have itching, I have this eczema, and I have this problem. So Fatak, he was just listening like that. And Fatak, towards the later part of his life, he became blind. I hope you know that. And that is when his analysis of homeopathy went to another level. He became very, very sharp. So Fatak just listened. Acha. Aur batao. Tell more. So he started saying, I have eczema, I have this, I have that, I have this, I have that, I have this. So Fatak is listening. Acha, beta, tell me, when is the itching more? So the patient says, Doctor, I don't get itching. Fatak got angry. What are you saying? You don't get any. How come you don't get itching at all? Yeah, now that is the peculiarity. That this guy gets eruptions without itching. Now that is basically two remedies. That is basically, you can see, one remedy is cuprum aceticum. Cuprum aceticum. But what happens in cuprum aceticum? You can see this eruption without itching. Okay, but it is a little wet eruptions. Okay, in cuprum aceticum. In cicuta, yes, cicuta is a remedy. In cicuta, you can read it from Fatak Materia Medica. You can see very nicely. Eczema without itching. Very beautiful. And especially lemon crust. Let's take a look at. And there must be more symptoms to the case. I cannot tell you about the entire case of Fatak, but this is the beauty that I want you to remember. So this is eliciting peculiarities. Chalo, let's go ahead. Let's go ahead in this case, epilepsy. Past history. What happened past history? Doctor's childhood, He had a very bad head injury and very, very big acne on the face and typhoid. And he had nocturnal enuresis. Acha, okay. What else can you tell me? In family history, there's a strong history of tuberculosis. Okay. Mhm. Now I'm just looking at the child. Huh? The child is just looking here and there. I'm just looking at. He's quite fat, huh? And just looking here and there and not very active, very dull. I said okay. So the father tells me his memory is very weak. He cannot remember things. Very forgetful. But sometimes he acts childish. Now when they say this, he suddenly starts giggling. These are the things you have to see. Just observations. Just observations. But he is very shy, and sometimes he can hit anyone in between. Suddenly he will go and hit. Tell more. Doctor, and he gets very angry. I said, why does he get angry? Especially when he feels that no one is understanding him. That is when he gets very angry. Someone doesn't understand him. People don't understand him. He's very angry. And someone tries to make him understand anything particularly, and he's not understanding. Still, he gets very angry. If his father doesn't allow him to go outside, if someone says something about his family, he can get angry. And in the anger, he can go and hit people. No? Tell more. Fears? We don't feel he's scared of anything. They say. Okay. Tell more. What about dreams? Bhagwan. About gods, he gets many dreams. Sure. What else? He get many dreams, sometimes scary dreams also. He just loves playing on the mobile phone. So he's a mobile phone addict. What he watches, no one knows. Okay. But out of 24 hours, he's on the phone for 16 hours. Now that they say, his father says he has an addiction. Sometimes, maybe pornography, maybe some TikTok or God knows whatever. But he's addicted to this mobile phone. This is what they say. Especially when parents don't allow him to use the mobile phone, he can get abusive. He will say very bad words. Heck! Abusive. देखो. Lot of desire for curd, sour curd or yogurt. He likes rainy weather. He generally sleep on abdomen and sweat. He sweats a lot and typically after convulsions. Mother's history during pregnancy. Nothing specific, but the only thing they said is that she came to know during her pregnancy that the father-in-law had a heart attack and he died. And that affected her a lot and she got fever after that. That is the thing that they say. Other than that, nothing specific that we have. Has taken a few homeopathic remedies, but we don't know which medicines. Okay. And on observation, and these are observations that Utsav has also taken because he had taken this case. Initial history was taken by him. So he has noted this in the case form, and I also confirmed this. One is he's talking in jerks. You ask the child any question, he looks at you for a long time like this. And it takes time to answer. He looks a little older than his age. He's his age is 15, but he looks like 25. Very shy to talk, doesn't talk much. Very introvert, and takes a lot of time to understand a question and answer. Very childish behavior. That's the other thing. Yeah. So this is the case in short. Batao. Talking in jerks, which means he talks very suddenly. Ah! Tuti! Kya? Something like that. In spurts. He talks in spurts, not all the time. So let's see. It's a very simple case, but a very beautiful case. So I would like you to know what remedy you choose and why. The important thing is why. Remedy, you tell me it is hyoscyamus, cicuta, or whatever remedy. It makes no difference. Agaricus. No. Tell me the reason. Baraita carb. Tell me the reason. Write the reason there. That will help. So a lot of suggestions. Huh? It's a very simple case. Okay. So I'm going to directly show you the rubrics and not make it very this thing. Let's see what I've taken. First symptoms, unconsciousness during convulsions. Next symptom, perspiration, convulsion after. Next symptom, convulsion during sleep. Next symptom, timidity. Next symptom, development mental arrested. Another symptom, striking. Another symptom, anger when not understood. And yes, ladies and gentlemen, the remedy that comes up is Bufo. And it looks very much like hyoscyamus. Bufo is a mixture of hyoscyamus, cuprum metallicum, and Baraitaka, all three. So it is hyoscyamus, cuprum metallicum, Baraitaka. So Bufo has convulsions like cuprum metallicum. It has this shamelessness, sexuality like hyoscyamus, and the dullness of Baraitaka. So that's what. Hyos plus Baraita plus, I'm giving you one more cuprum. Okay? That's Bufo. What did I give? First off, I gave Baraita carb 200C 2 times a day for 7 days because he was getting constant fits. Okay. Very beautifully. Within 1 month, and he was getting fits almost every week like this. And his within the first month, number one is anger reduced. His desire for anger reduced. Number two, symptom reduces, acne reduced. So this is the thing. You will see the generals improving, the headache reduced. We repeated again, Bufo. Now 2 months, no convulsions at all. And remember, he was getting convulsions every week. Acne improved further in the 3rd month. Acne totally reduced. No convulsion attack. No convulsion attack on the 5th month. And now almost close to a year. And remarkable change in the entire year, hardly 1 or 2 attacks. That's it. And he was getting an attack every week. His acne, his anger, his understanding improved. That is the main thing. He started develop. So his father came and met me about a year after the treatment, and he was so happy with the treatment. Remarkable change, and it's still a case. It's still a case that we are working at. Yeah, I wouldn't say it's a complete cure, but we are still working on it. But it's a beautiful result.